Like in CSR, we were getting the typical mushroom pattern or the ink blot pattern. We get here the typical flower petal appearance. So this flower petal appearance on the FFA is very typically found in the cystoid macular edema. Why? Because we are having the fluid in the two layers, that is outer plexiform layer or the inner nuclear layer. Always think about again open, okay? And this outer plexiform layer is also called as the Henle's layer, another PYQ. It is also called as the Henle's layer, and this contains the petaloid fibers. It contains the petaloid fibers, and that is why we get the flower petal appearance. So very typically found, and because we are having the multiple cyst-like areas, therefore over the fundus also we get the typical honeycomb appearance. In the fundus, we get the typical honeycomb appearance when we get the flower petal appearance on FFA. Now, what is very important here is the etiology of CME. Very important. One is the retinitis pigmentosa. Number two, it can be associated with the uveitis. And number three is the niacin toxicity. So this question came in 2020 NEET, that which vitamin in the supraphysiological doses can cause a cystoid macular edema. Number 4 is the prostaglandin analogs. Prostaglandin analogs are there. Then I told you non-ischemic kind of CRVO, that is there. Then we have the Irwin gas syndrome. Another important thing is the Irwin gas syndrome. And I hope you remember what was it. This is after the cataract surgery. If it is occurring after the cataract surgery, it is called as the Irwin gas syndrome. Then we can have in the diabetic retinopathy. And finally, we can also have the epinephrine. Epinephrine can also cause cystoid macular edema in cases of the aphakia. All these are very important causes of cystoid macular edema. Once you are sure you can treatment will be steroids. Okay, there we were doing wait and watch. Here we have to give the steroids. So all of the clinical profile you know.